What I wanted to talk about today is sacroiliac joint pain, and this is typical of pain being experienced in the lower part of the pelvis. If you can imagine that the spine is connected to the pelvis via these two joints. They're kind of large in nature, and there are two of them either side just below the bottom part of your pelvis, and they normally connect the spine, as mentioned, to the big bones in the pelvis. They're particularly situated towards the back, and they can be quite sore, particularly if there is some inflammation or irritation of these joints. This type of sacroiliac joint pain can be particularly quite sore when bending over, when walking, when running, and can be really particularly disabling in certain circumstances. They can be affected because of other problems in other parts of your body, particularly if you have a bad hip or if you have a bad knee. These types of pains in the sacroiliac joints can be affected as a result of the way that you walk. So the problem is that these joints can be quite painful, quite sore, and the question is how do we get rid of this? Well, in particular, what we would need to do is to take a full assessment, maybe talk about the type of pain that you're experiencing, see if it kind of matches up to this type of pain, and then obviously we might well want to consider some investigations. This might include some form of X-ray or possibly MRI or even a CT scan. Once we have the diagnosis, we can consider treatment for this. In the first instance, of course, the most minimally invasive form of treatment is exercise, physiotherapy, and we can obviously show you good physiotherapists that might well be able to help you with this type of pain. After that, we can consider some type of medication. In the most cases, it's simple analgesics, things like paracetamol, possibly anti-inflammatories, if that's something that is you tolerate. That can sometimes help to possibly reduce the pain, and maybe actually help you engage in physiotherapy a little bit further. After that, and if that doesn't work, then we can consider things like sacroiliac joint injections. These injections are done under X-ray guidance or possibly under CT guidance if necessary, whichever way that is necessary, and we deliver local anesthetic and steroid into those joints. These injections obviously are performed in theatre with careful, maybe mild sedation if necessary. These injections do come with the potential of side effects. There is a potential that we can make the pain a little bit worse for 24 hours, 48 hours because of the needles that we use. But in particular, it normally kicks in maybe on the third or fourth day. The other potential side effects, it can cause some bruising. There is a potential risk of causing damage to other structures in the vicinity, and carefully, because of where they're situated, the nerves are quite some distance away, and the potential of any nerve damage is very, very small. These injections are quite straightforward to do. It normally takes in the region of about 20 to 30 minutes, maybe a little bit longer. But if this comes back positive, then and there is some degree of pain relief, well, there is a potential of taking it one step further. If the pain does come back, and after the injections of local anesthetic and steroid, there is a potential of performing what we call radiofrequency denervation of the sacroiliac joint. So this is a process by which we try and curtail the nerve supply to the joints. So we do this by a process of burning those nerves that supply the joint, and hopefully allowing the patient to experience a longer period of pain relief that might not be attributed just to the local anesthetic and steroid. We normally follow this up after a positive sacroiliac joint injection with local anesthetic and steroid, but that is something that obviously has to be discussed with your practitioner.